Not hereditary in a sense that they are given from father or mother directly to children, like we know that from other diseases where it's very clear that a certain percentage of children will get the disease. But clearly there is a kind of genetic predisposition. So very frequently it does run in the back problems do run in the family. A couple of months ago, I've operated a 21-year-old with a disc herniation, big disc herniation, and 13 years ago, I had done the same surgery for his father. So yes, and sometimes there is a correlation, but it's a genetic predisposition on one hand, and then the environmental influence on the other hand. So other factors are smoking, obesity, lack of exercising, but also this may be in a family. So if your parents smoke, you're probably more likely to start smoking yourself. Yes, that is something we see very, very frequently. Well, first of all, it's because of the nerves. So the nerves run from the neck into your arm or from the back into your legs. And so this is what you probably have heard of, like what is called sciatica. So an electrical shooting pain that goes into your leg. But also other degenerations in the spine can cause a referred pain that radiates into the hip. And this is where you then really need to examine the patient very closely to find out whether it is a problem inside the hip, in the hip joint, in the knee joint, or if it originates in the spine. And this can be sometimes very, very tricky to find out, and you need to be a real expert. What I learned over the years is to listen to the patients. I spend a long time asking questions. When does the pain occur? When is it worst? What improves the pain? How did it start? So talking to the patients, this is, in my opinion, the most important. And in probably 70% of the patients I see, I do have an idea in which direction it goes after that. Of course, then you do examine the patients. That's important. That gives some other important information. And then you will need some imaging, whether that is X-ray or MRI or probably both. And then you need to match this information. And this is well, sometimes very clear, and it gives a perfect image, but sometimes it's tricky, and you need to see the patient again. Symptoms sometimes change, so it's not always easy. And the last well bit of information perhaps is diagnostic injections. So if you do have an idea, but it could be this or that, or some patients suffer from different problems, more than one issue, then you can do an injection under X-ray guidance directly to one spot, numb this area, and then see to which extent this improves the pain, what kind of pain disappears and what perhaps stays, and that gives you then more information. Of course, you cannot, as we said in the beginning, you cannot change your parents. So there is this genetic predisposition, but you can change the environmental factors. So you shouldn't start smoking, or if you do, stop it, because this reduces the nutrition of the discs. That's one very important factor. And then it's good to do some regular exercises. So keywords are Pilates or yoga. Pilates is more for the core strength, stabilization, improving your muscles, and yoga is for, well, stretching, remaining flexible. You do not need to overdo it, but doing some regular exercises, that's probably the best you can do. Of course, you should see a doctor when the pain is very severe, when the pain does not, when you have back pain, and the pain does not improve with what you would do first, which is rest, apply some heat, take painkillers or anti-inflammatories like ibuprofen or Voltarol. So to have severe back pain for 2-3 days, this is something that happens to many people, and as long as it improves after a few days, it's usually nothing to worry and nothing sinister. Of course, this is different when you do have other illnesses, other diseases that could cause back pain, or you've had an accident, you fell down, or you know that there is an osteoporosis, and then, for example, the back pain may be caused by a fracture of a vertebral body. So in more individual cases, you should see a doctor more early. Otherwise, it's when we speak about this chronic back pain, that is more like a dull ache and depends on positions of birth in the morning when standing up, or at night when turning around. This is something most patients I see complain of. So then, well, it's usually nothing sinister. It is most likely just wear and tear, but the point may come where you simply say, well, I want to know what it is. I can't go on like this. I had to stop my sport and work is affected. So then you needed to see a doctor. And it is something different, of course, if there is a numbness and weakness in your legs, or your frequency you have to go to the toilet changes, and this is related to back pain at the same time, or electric shooting pain in the legs. Well, this is clearly something you need to see a doctor probably immediately or very early.